Timothy Ndiwalana, a member of a village health team of Makai Zone, Namirembe Bakuli Parish, Rubaga Division, says he starts his day at 6 a.m. by visiting and reviewing community members who were ill the previous day, especially the elderly, expectant mothers and children. But what made Ndiwalana to become a village health worker?
No any single day I regret doing this. I joined VHT. It was a passion. I lost a sister when I was young, and I lost a sister because of negligence of health factors. So when I told myself when I grow up, I will study medicine. When I failed medicine, when I failed to study medicine, I went to Medicare and did my clinical medicine as a diploma. But after studying it, I realized that what I'm trying to prevent, I can't prevent it while I'm in that field. So I decided to go public, to go in public health, where I can save many. So I don't regret taking this path. I've saved many children. There are children who had even were at the verge of being paralyzed, but now they are healthy. When I look at them, I feel the vibe that I'm doing some good work, I'm saving lives.
The major roles and responsibilities of village health team include home visiting, mobilization of communities for utilization of health services, health promotion and education.
We have to ensure that people get all the health services they need, and we have to do mainly the preventive part of the system. We have to prevent people to get diseases. As you can see, this place is a ghetto, but our people are healthy. They spend less on health because we always do the prevention in our community.
Ndiwalana says all is not rosy with community engagement on health matters as they encounter numerous challenges.
Government have not recognized the VHTs because as you can see, we don't have PPEs. We buy uniforms on ourselves. Government pay us per activity. Then even sometimes the facilitation given per activity is not on time, and at times we don't even get that facilitation.
Village health teams were established by the Ministry of Health to empower communities to take part in the decisions that affect their health, mobilize communities for their health programs, and strengthen the delivery of health services at household level. Ndiwalana, together with his team, says that government has not done enough on facilitating and recognizing them.
The government will look into our work and see the big work we do, and at least put VHTs on payroll, and they start getting some little salary at least to motivate them and do their work daily.
There is a gap between VHTs and health facilities in that they use you when they want you. And actually it is not their responsibility, though it is the government's responsibility.
The Director, Public Health at the Ministry of Health, Dr. Daniel Chabainze, says government has integrated VHTs in the development and operational plans of the Ministry of Health and appreciated their numerous work.
Entry point as our trusted teams. When we want to do interventions in a house, they help us lead us to the community because these are the people who are not, so they become the gatekeepers into our household entry point. Yes, that's why we think we are slowly integrating them in our health services. We've also developed policy guidelines in how we shall deploy them, how we train them, including working ways to how to motivate them.
But are there guidelines that govern VHTs in the country?
We have gotten VHT training charts, VHT SOPs. We've given how we teach them how to examine a person who comes to them, even if it's for malaria, even if it's to treating pneumonia. We've given them guidelines in how to record into registries people who they have treated. First of all, they need to be able to write. We've also given them guidelines in how to handle cases. For instance, in COVID, they were part of the teams that we were using to help us treat. So depending on the size of the villages, we give them supplies, and these guidelines have shown what does a VHT kit involves. They also support us in community engagement. What are our community engagement guidelines? So all these are aimed at using these teams to be able to get equipped, because we know that they are not formally trained in healthcare and health promotion, but these guidelines and standards help us to make sure that they are learning and we can track their performance.
In response to address some of the challenges VHTs face, the Permanent Secretary at the Ministry of Health, Dr. Diana Twini, says the Ministry of Health proposed some incentives to motivate the VHT members.
We have over 100,000 in the country, actually over 150,000. They are more than our health workers in the country. Now, it was not possible to put them on a salary because of the budgetary constraint. But we are looking at also other alternatives. Like at parish, if we introduced at least 2, instead of looking at village level. And we are piloting to see how this can work. If this can work, then we'll come back to, because we had proposed and we came up with a strategy, which we presented, although still at that time the fear was, where do we get all this money to pay? And so somehow it was halted. But we are glad that along the way, PDM came in handy, because PDM is actually a replica of what in health for us we had come up earlier, many years, like 6 years ago. So we wanted really to focus at household level to strengthen services, primary health care, community interventions, teach people how, issues.
Village health workers serve as valuable resource to address public health needs in resource-limited settings. The successful implementation of VHTs can be limited by poor acceptability among community members. Zahara Abigaba, UBC News.